Welcome to the Kratom Sobriety Podcast. This is Lily today, and I am interviewing Jessica E. How's it going, Jessica?
Hello. I'm well. How are
Welcome.
you?
Doing good. I'm happy to be doing this today. It's a perfect day for an interview. So, how would you like to introduce yourself to the listeners today?
Okay. Again, my name is Jessica E, and I currently live in the Midwest, but I'm originally from a beach town in California. I have a 3.5-month-old son and a 19-year-old son, and I'm married and currently a stay-at-home mom.
Amazing. And what do you get into for fun or relaxation these days?
I enjoy going on nature walks with my husband, my baby, and our dog. I also enjoy listening to music, singing and dancing. And I'd say right about now, I like to relax by listening to podcasts and sitting out on my back porch with my baby and blowing bubbles.
Oh, that's
Yes.
amazing. I love bubbles. Blowing bubbles is very therapeutic. And
Mm-hmm.
it's also a therapeutic secret breathwork technique because it makes you slow down the exhale. So it's actually that's one of the tricks that they teach kids that are new to breathwork, because all kids are new to breathwork. Imagine like you're blowing
Right.
bubbles. You exhale for a long time. I thought that was cute.
Aw, yeah, I didn't know that, but that's totally awesome.
Yeah. So, what is your Kratom quit date and where are you in your sobriety journey right now?
Okay, my Kratom quit date is September 5th, 2024. I have not used Kratom since, and today I have been sober from Kratom for 1 year, 7 months, and 20 days.
Yeah, that's amazing. Congrats.
Thank you.
Yeah, so you're well into it. You're past a year and a half. That's amazing. So, take us back to your first introduction to Kratom. Like, how did you find it and what was going on in your life at the time that you found it?
Let's see. The first time when I was introduced to Kratom, I lived in Santa Cruz, California. This was in 2015. At that time, I was a single mother. I was attending college full time and working multiple part-time jobs. So I was very busy. I was very stressed. I was introduced to Kratom. It was introduced to me as a powdered tea from a tree in Asia at an herbal apothecary shop, which is a place that sells plant-based remedies such as herbs, tinctures, and teas. Kratom was marketed to me as a natural alternative to managing pain in the body and increasing energy. I've struggled with back pain since my early 20s, and I have been in a few car accidents, but I also carry stress and trauma in my back. So I was under the impression that Kratom was a safe alternative to opioids and was going to safely reduce my back pain.
Yeah. And so you met someone at the herbal remedy shop and they were telling you about Kratom at that time. Okay.
Yes,
So,
and of course
yeah.
she's like a hippie chick.
Yeah,
It just seemed natural and nothing to worry about.
exactly. Did you use any substances or have an issue with addiction in any way before you were introduced to Kratom?
Let's see, substances have played a role in my life off and on since I was 15 years old. Today I'm 39, and I have used and quit different substances throughout my life, beginning with cigarettes. And I thought I was sober while using Kratom until I realized my body had become addicted to it.
Yeah, same here. I thought I was sober too when I used it. Pretty scary, huh? Absolutely. So when you started the Kratom, were you just drinking it as the powder, as the tea for a while, or how did that start to progress for you?
Okay, so let's see. It all began with the powder. So it came in powder form, and I was instructed to put it into orange juice or grapefruit juice, mix it up and drink it like that.
Yeah.
yeah, that's how I began using it.
So, how did your kratom use change over time? Like after you found the tea and the powder and you were having that from the health shop? Like, how did that start and progress? And what was your use like over time?
Let's see, when I first tried Kratom in 2015, I used it for about 2 weeks and then I stopped and there was no issue for me. And then I basically forgot about Kratom for years after that until it came time for me to pack to move to the Midwest in the summer of 2022. I ended up going back to that herbal apothecary shop and purchased more kratom for my back pain and for energy for packing. I didn't use much during that move, but I did end up holding on to that bag of kratom that I had purchased, so I had it. And then in spring of 2023, while working as a social worker, I came across the old bag of kratom amongst my bag of supplements that I have, and I ended up taking some. And at that time of my life, I was very stressed. I was burnt out from my job, and kratom made me feel happier, energized, and reduced my back pain. And from that point, I began using regularly, which turned to daily use. I began hanging out at a local kava bar, which there are a few out here in the area where I live, and they happen to sell kratom drinks, which they market as ethnobotanical drinks, which are beverages derived from plants. And they also market themselves as a safe, sober, quote unquote, community. I observed that many people who spent time at the kava bar, myself included, and consumed kratom drinks were in recovery, like sober from alcohol and or drugs. And eventually I realized I was spending a lot of money daily at the kava bar purchasing kratom drinks. I became self-conscious because I was showing up at the kava bar as soon as they'd open around 11 a.m. Like I was like the first customer there. So I began purchasing kratom capsules online and then using privately at home. So that's how my use escalated.
Okay, so you
Mhm.
found kind of community at the kava bar, and then you're starting to
Mhm.
go earlier and earlier, so you needed to buy your own supply for when they're not open, right?
Yes, basically, because I would find that even though they'd open around 11 a.m., I still, if I woke up, say, at 8 a.m. that morning, as the hours progressed, I would feel myself starting to experience withdrawal symptoms.
Yeah.
So I was just waiting for the kava bar to open, you know?
Yeah. Did you know that it was withdrawal symptoms, or were you just, "Oh gosh, I just really need this to start my day," like coffee, or what were you thinking at that time?
I guess I could say that in the beginning, it was more, yeah, that's a good comparison, like coffee. I need this to get going, not really wrapping my brain around the fact that my body was becoming addicted to this substance.
Yeah. Yeah, okay. So, you
Mhm.
said at one point you were becoming self-conscious and aware because you were there often and spending a lot of money, like, how long were you in this cycle of regular use and spending money before you had a big aha moment about your habit?
I was using Kratom for about a year. I'd say maybe, yeah, I'd say around a year before I realized this has become a problem. Yeah.
Yeah. Did you have a big moment or a trigger that caused that thought? Did you spend a lot more money than usual, or were you getting more anxious without it? Was there a peak experience that you want to share?
I'd say that I realized kratom had become a problem for me when I was using it daily and experienced withdrawal symptoms when I didn't use it, which led me to taking more so I wouldn't feel those terrible withdrawal symptoms.
Yeah. Fair. So,
Mhm.
how is your use affecting your life at home or your work or family?
Let's see. It didn't interfere with my job, which is good, but it did interfere with my relationships, I will say, because firstly, before I realized that kratom was addictive and extremely hard to quit once addicted, unfortunately, I had introduced a close family member to it, and we would use it together and then go for a walk and walk and talk. And I just thought it was totally fine, and which I deeply regret it because this person still uses kratom to this day. And yeah, and it makes me really sad because I feel like it's my fault. But I observed that when I'd come down from the euphoric high that kratom gave me, I'd become very irritable and have a short fuse. And I caught myself getting pretty nasty at times, like when I was coming down from it with like
Yeah.
this family member,
Yeah.
really.
That sounds hard. I think that's an experience many of us share, that in the time that we think that it's fine and we don't know what we know now, of course you think this thing is awesome and you want to share it with your close family and friends. Oh, I tried this new product. It's so great. You should try it. I tried this new lotion. I love it. It just seems like something to share that's great. So I hope that you
Mhm.
can forgive yourself, because it's not your fault. The advertising got through, and it hurts
Yeah.
people. And yeah. So you had some issues with like anger, irritability, basically. Okay.
Oh, yes.
Yeah. And what decided to push you to quit? What was that point for you, and what did you decide to do about it?
In addition to feeling like anger, like extreme anger outbursts and things like that, extreme irritability, I also, after about a year of using Kratom daily, began having severe panic attacks, which would come out of nowhere and felt extremely debilitating. At that point, I was taking about 8 or 9 grams of capsuled powdered Kratom daily. I noticed by roughly around 6 p.m. each day, I needed to take a bath with putting multiple cups of Epsom salt, along with taking some prescribed medications to reduce my anxiety, because I felt like I was like wanted to jump out of my own skin. I couldn't handle it. That's the sensation that I was experiencing from the kratom. Also, I had lived alone at the time and I felt very afraid and I was scared that I was going to die. I was scared that I was going to have a heart attack or something. I didn't know what was going to happen, but I just felt like the walls were coming in on me and I felt like something bad was going to happen. I tried quitting on my own, but I couldn't handle the physical and mental withdrawal symptoms. I felt like kratom had taken me hostage, and I eventually knew that I could not quit on my own. So I ended up speaking with my best friend, and I told him that I couldn't stop on my own, even though I'd tried and that I needed help.
I'm really glad you reached out to a friend to ask for support. That's really important. And what happened after you talked to your best friend?
Let's see, when I had quit on my own, I tried going cold turkey and I did this a few times and it only lasted a few days each time. So once I spoke with my best friend, he conducted research on kratom addiction and he ended up sending me to this place in Cancun, Mexico to receive ibogaine treatment, which ibogaine is a psychoactive compound derived from an African shrub and is used to treat opioid addiction, PTSD, TBIs, and depression.
Yeah. Yeah,
Hmm.
we've had a I think two different folks that have done the ibogaine treatment. And I'm always curious to learn more about it, because for me, I haven't taken it. I don't I I don't know that it's something that was in my ability at the time when I was quitting. It didn't even come across as a thought. I don't think I knew that it was for treating those things when I maybe had needed it. But were you fearful of treating one plant addiction with another plant that's psychoactive. I'm just curious about your thought process with that because a lot of us are like, oh, kratom's fine and natural and it's a plant. And then it's like, oh, hell no, it's not. Were you afraid of adverse effects with ibogaine? Were you worried about that?
Oh, I actually, believe it or not, never thought about that, like comparing the
Oh,
kratom to taking another plant medicine, quote unquote.
yeah.
But I did, and I do view ibogaine as a psychedelic, and I do believe in the healing power of psychedelics if used correctly and in a safe space,
Yeah,
like a treatment facility with trained medical professionals.
of course.
I will say that I was afraid, though, of taking ibogaine because I have taken big mushroom trips and that was like super intense. So I know that ibogaine is the grandfather of psychedelics. So, oh my gosh, if mushrooms was intense, what's ibogaine going to be like? So I did have that
Yeah.
nervousness going into it, but I was so desperate to get off of kratom, I was willing to try anything.
Yeah, definitely. That makes sense. And it's again, yeah, with a treatment facility and with professionals supervising you,
Yes.
that's a different story than taking mushrooms and maybe not having someone guiding you through it that's a professional. Although that can be really helpful too. If you have a professional and you can do that, that can be really healing for some people too. Um,
Yes, especially when
so,
are properly integrated after
yes.
the
Yeah.
trips. Yes.
So, what did that process look like? Did your friend help you apply to that program? And how soon between reaching out and getting in was that? Was it quick? Would it take a while?
My friend did reach out to the treatment center for me and basically coordinated my treatment and then basically came back and gave me a date that I'd be able to enter treatment. So then I found my plane ticket and made sure to get on that plane to Cancun.
Yeah,
And then I'd say it was a matter of, I believe it was roughly around 2 to 3 weeks after deciding I was going to go to this treatment center that I was able to attend.
that's amazing. That's
Hmm.
great. What was that treatment program like? Can you take us through the process of what that looked like for you?
Yes. So basically, when I got to Cancun, they had somebody come pick me up and bring me to the facility. And then once I got to the facility, they went through my belongings. They took my kratom. They didn't take it. They had me flush it down the toilet
Okay.
and basically say goodbye to it because I did use all the way up until I got there, of course.
Yeah.
And so they went through my things and then they went through my list of medications and they had to detox me I had to come off of the medications that I was on, which I was on gabapentin and lorazepam at the time. I don't take those medications anymore. I'm like totally, totally clean at this point. No prescribed meds either. But I had to come off of the kratom and they were giving me a very low dose of morphine, like super low to help me with the withdrawal.
Okay.
Yeah, so by the time, let's see, I believe I had to withdraw, I believe that was like 7 to 10 days. I forgot the exact amount of days, but before I had my ibogaine, my flood dose, because you have a flood dose which is a very large dose, and then you follow it up like 2 days later, I believe, a day or two, yeah, 2 days later with a booster, and then you skip a day, I believe, again, and then do another booster. I forgot the
Okay.
sequence of that, and then while I was detoxing, leading up to my ibogaine flood dose, I was engaging in different activities like yoga and different groups and meditation and sound therapy and swimming and living in community with the other people at the treatment center and eating well and things like that. Journaling, reflecting, preparing.
That sounds like a really wonderful group dynamic too. Would you say it was a small group that was staying there? Was it 10 people, 30 people?
I would say there was probably around 10 of us at the time that I was there. Not everyone was there for substances. There were people there for substances that stayed in the same house as me, but then there was another house across the street where people with who were there for depression or TBIs were there as well. So the reason that those of us that were there for substances were in the main house together is because that's where the nurses station was. So we were close to like where they have medications and things
Yeah.
like that.
Okay. And for those who don't know, a TBI is traumatic brain injury.
Yes.
Yeah. And then, okay. So was everyone on their own timeline and protocol, or were you doing the ibogaine treatments in unison with other people?
But we were on our own timelines and protocol, yes.
Cool.
Mm.
Okay. So when you take the ibogaine, is it in a tincture form and they sit you down and give it to you? What does that look like?
First, you wake up very early and then they sage you outside.
Yeah.
Actually, sorry, we light our candle first and then we go outside and we're saged and essentially prayed over and prepared to take the ibogaine, but we're taken into the room where we're going to be given the ibogaine and we're properly connected to the machines so that they're monitoring our heart because that's a
Yeah.
huge thing that's very important
Yeah.
as and things like that. And then once we're all set up, which there are medical professionals in the room with us the entire time, and there's only 2 people at a time doing the flood dose with a nurse right there at your bedside.
Amazing.
Yes, then we're given the ibogaine in little capsules and we basically say a prayer before taking the ibogaine.
Yeah.
And then you lay down, you put some headphones on that they provide you with and listening to some mellow instrumental music, as well as you wear an eye mask and you're just in this bed, comfortable, relaxing, and letting the ibogaine come on, the
Yeah.
experience come on.
So that's really nice to hear. So there's basically no external influence going on. You're not looking around. You're in your own world. You've got your eyes covered and you're listening to music. You're having a guided psychedelic experience and you're not wandering around in nature freaking out if you see a weird tree. It's a safe environment. They've got the nurse there.
Yes.
That sounds really ideal.
It's very controlled. The lights are down. There's no lights on. They do have those little projectors with the stars that go on the ceilings and stuff. They have that going, but that's it. And they help you to and from the restroom throughout your trip when you have to use the restroom.
Yeah. What is that time frame like for the main large dose? Is that like all day long or is it a couple hours?
It was 14 hours. Yes. 14 hours. But I felt lost in time. I had no concept of time. That's for sure.
You start first thing in the morning and then by the
Mhm.
time you're done, it's nighttime. You a whole day there. Did you
Yes.
I want to ask about afterwards, but I'm not going to jump there yet.
Okay.
What do you remember going through your mind, if anything? What sensations or thoughts were you having, if you can recall?
For me, okay, I am not the type of person who can close my eyes and visualize something.
Okay.
I am unable to visualize in my mind's eye. I am a deep feeler. I feel emotions very intensely, but I can't visualize in my brain. So I didn't see anything, even though I have seen things on other psychedelics in the past. But with ibogaine, I did not. It was just more so, I felt like I was purging the demon, quote unquote, of kratom addiction. I felt like I was purging a demon.
Yeah.
That was my experience because I was vomiting a lot and it felt violent for me. It did scare me. It was very intense, but I felt like it was like a demon that was coming out of me.
Yeah.
That was my experience.
Yeah, that makes sense. You're letting go and you're getting all of it out. So, are you hooked up to an IV with fluids during this time so that you stay hydrated? Yeah, cool.
Yes.
Yeah.
Yes. Also with electrolytes. Yeah, they're giving you
Yeah.
electrolytes the whole time too through IV.
Okay. That's
Yeah.
amazing. I know with some medicine journeys, they have certain protocols for like how to extra hydrate beforehand because you're not in a medical setup like that. So that's great. Okay.
Hmm.
So what other things happen during the ibogaine? Is throwing up pretty much a common experience? Is that expected?
I was told that was totally normal. That happens to people. Not everyone, but some. It's not the same experience for everyone. I heard some people who had gone in there who had the best experience and it felt so loving and positive and all these things the way they described it. Or some people having life reviews and things like that. My experience was not that, but it was exactly what I personally needed, though.
Exactly. Yeah. Yeah. Psychedelics, it's different for everyone for sure, what you
Hmm.
get out of it and what it gives you and what you need. Okay. Yeah. So when you finish this experience and it's nighttime, did you just immediately want to sleep forever and ever? Or were you like,
Oh my
what
gosh, yes. No, you are correct. I wanted to, it was like I had to be helped to my room basically. And I basically slept for 2 days.
dude?
Yeah. And the nurses kept coming and checking on me and bringing me smoothies because I wasn't coming out for meals.
Yeah.
But they were making sure I was still getting vitamins and hydration and water and everything. So they still were taking good care of me in my room. I was just so lethargic and so tired. I did not want to go out of my room. I also felt overstimulated. So I wanted to be in the quiet darkness of my room and not
Yeah.
be out with people hearing talking and music and things. I just didn't want that at that time.
Yeah. Again, it's like you said, the integrate integration of all of that is important and having that
Yes.
cocoon slowly open up to the world is important too. So, how long was your experience at that center, like time-wise?
I was there for, I was initially, I believe, supposed to be there for just 2 weeks, but I did end up staying a few extra days because I was so scared of the flood dose that I was fearful of doing my boosters because I didn't know if I could handle if my nervous system could handle the intensity. But then I knew, I'm like, I cannot leave here without doing these boosters. I need to see this all the way through.
Yeah.
I'm just feeling overwhelmed because the flood dose was so intense.
Yeah.
And yeah, so I didn't actually begin my boosters on time when I was supposed to. It took me an extra day,
Okay.
but I did end up doing them. And then the boosters, it was essentially like microdoses. So it was like nothing compared to the flood dose. I was super aware. I was very calm. I was in my body. It was nothing to be afraid of at all.
Yeah, your body already had that experience. It was like, "Oh, yeah, I know this. I know what to do with it now." Yeah.
Yes.
Cool.
And it was like so mellow. Yes.
Yeah. So, after those 2 microdose small boosters after the big dose, after all of that treatment was finished, did you have, I don't know, an immediate mindset shift with cravings? Or was there an immediate shift or something
Mhm.
hit you, or was it gradual?
I will say that the ibogaine totally wiped away my craving for kratom. I have not had a single craving for kratom ever since I've done it again.
And when
Mhm.
your treatment
No.
was in 2024? Fall 24?
Yes. September 5th of 2024 was my quit date, and then I did the treatment a week later.
Wow, that's amazing. So you finished your ibogaine treatment and you haven't had any cravings since?
No.
I'm like, you can't listeners can't see my face, but my jaw is dropped. I'm like, "What?"
Yes.
That's amazing. I'm really happy to
And
hear that stuff like this helps and can help people.
Hey, oh, definitely. And the thing is, too, is again, like I had mentioned, how I had introduced a very close family member to kratom in the past. That person still uses kratom, and I still know that they take it every day, and
Yeah.
so it's kratom still brought up to me in that way. Same with I see kratom sold at different places, like
Yeah.
head shops or vape shops or whatever places around town, but I just and I know I could walk into a store and get it, or I could just jump online and order some, but I just have zero desire. Thank God.
So you see those signs now and the person in your life on it, and you're not
Hmm.
thinking, maybe I should, or what about today? None of that.
No, and I have experienced that plenty of times with substances in the past.
Yeah.
And even with kratom before I did the ibogaine, I felt that way before getting the treatment.
Now, would you say that this has applied to like all of your cravings and addictions over time? Has this also wiped away random thoughts of using cigarettes again or other things that you had quit?
With nicotine products, because I was vaping heavily at that time, I did quit vaping. It helped with that for a couple months. And then I did end up picking back up nicotine, like
Yeah.
chewing Nicorette. But then I ultimately ended up quitting when I found out I was pregnant with my infant.
Yeah. And you would say that quitting kratom was much more difficult than the vaping nicotine?
Nicotine was not easy to quit, but I did another treatment for that in the end. That AccuLaser is what I had done. It was like a cold laser on acupressure points throughout my body. It helped me with quitting nicotine.
Wow, I've
But
never
yes,
heard of that. Cool.
yes, it's called AccuLaser. But kratom, I'd say, was the hardest substance that I have ever gotten off of.
Yeah. So,
Hardest to quit.
yeah, I agree. I would, yeah, that's the overall consensus in general. Even some of the harder drugs that we hear about, we've even had folks coming off of actual heroin or fentanyl, and they said that the withdrawal process from kratom was just as bad, if not worse, depending on what was going on. I mean, so another question after your ibogaine treatment, did you, for, I don't know, for any reason, have a draw to go back and do another round of ibogaine treatment? Was that ever a draw for you, just to see what else could happen or how it could improve your life? Because I know some people, not that they get addicted to it, but they get excited about what else it could do for them because it helps so much with the addiction. Like,
Oh, definitely. In fact, I do plan on sometime in the future having ibogaine treatment again, attending it because I do have complex PTSD. So I would like to do some work around that.
yeah,
But now that I have a 3.5-month-old baby, it's going to be a while
yeah.
before I'm able to do something like that. But I definitely will again in the future. And I really hope it becomes legal here in the US I really do.
And I think that it's once you find something that is helpful for you, no matter what it is, if it is helpful and it has changed your life for the better and it's available to do again, to go deeper with it, I don't know, you find what works for you, right? And if something works, maybe you want to see what else you can apply it to. Or, okay, now that I'm not in this crisis mode, treating just the crisis mode, like maybe I can elevate this other aspect of my life because I'm not in total breakdown crisis. Now I could actually look into this deeper aspect, like your CPTSD. Did they say that it helps with that in addition to the depression and brain injury and all that?
Yes. In fact, there was a veteran that was there getting treatment for complex PTSD.
That's cool.
Mm.
Curious, did they tell you about any contraindications for people that are interested in going to treatment? Oh, you can't go if this or that.
Basically, you have to be evaluated and definitely have to make sure you don't have heart issues, pre-existing heart issues.
Yeah.
And also, you're depending on whatever your medication list is, they have to go through it with a fine tooth comb with you to make sure that you're not on any medications that could negatively interact with the ibogaine.
Yeah.
They'll take you off of it before you're giving you the ibogaine.
Okay. Yeah. I'm glad they do that too. Of course they do. It's
Mhm.
good to hear. It's good to hear that.
Yes.
Okay. And then can we talk about your integration period after the treatment? I guess the first month back integrating. So let's talk about the month after that.
Okay. I will say in regards to how I felt physically and emotionally during that first month, I did still experience physically feeling lethargic. So it did take me a little bit of time before I had more energy. Emotionally, I did feel like I was experiencing flat affect for a little bit, but that didn't stick around very long. And flat affect is the feeling of having a lack of emotions. I did experience pause, but it was on a much lighter note, post-acute withdrawal syndrome. And as far as integration is concerned, I did a lot of journaling and I did have a follow-up session online with essentially what you consider a guide who had taken me through the process. I spoke with him in the beginning before going to Cancun, then while I was in Cancun, and then also once I returned home after the treatment.
Oh, great. That's wonderful. They followed up with
Hmm.
you afterwards to check in. That's amazing.
Yes.
Okay. What other tools and supports beyond that guide and the follow-up, what other tools helped you throughout that time afterwards?
First and foremost, I have refrained from going to any kava bar. I don't look up Kratom online. I don't hang out with any of the people that I had become friends with that I met at the kava bar. It was too triggering for me. And I just continue to receive support from my best friend. He lives in California, talking to him on the phone. And then let's see, praying to my higher power and just maintaining faith and engaging in my spirituality as well.
That's amazing. At what point did you find this podcast in your process? Did you find it when you were using or afterwards?
I found this podcast after I had gotten sober. I was actually just curious, is there any Kratom sobriety podcast out there? And sure enough, I found yours. Yeah, and I listened to some episodes and I thought it was cool. And it's helped me with maintaining my sobriety as well. It's just like being able to go to a meeting and hearing somebody share their story, their experience, strength, and hope. But I don't have to leave my house. I get to do it here at home.
Yeah, that's great. Did it so it helped you. That's great. Yeah, that's found that too. It's like a breath of fresh air. Oh, there's other people in the world that went through this and I'm not alone. That's important.
Oh, yeah.
What is so I know you're a new mom and how were you pregnant shortly after you quit and went through the treatment then? Am I doing the math right?
I got pregnant 7 months after treatment.
That's wonderful. And you're a new mother again. Yes, you're in that
Yes.
yes, motherhood moment again with a new baby.
Mm.
And how has that felt in this stage of life with recovery and everything? Any thoughts that you have on that?
I'm very grateful that I was able to conceive at my age.
Yeah.
I'm grateful that I'm in a position in life now that allows me to be a stay-at-home mom. It My experience wasn't that when I was raising my son who's now 19. I was a single mom living in California and it was very expensive, very stressful, and I was very young. So I learned a lot along the way, but now I'm in a different place in life and I have this stability because I'm also married and my husband is very supportive and he's a normie. So he, yeah, but he's been a
So
huge support.
so no
A
addiction.
nor-
Is that what you mean by normie?
that is what I mean.
Got
Yes,
it.
sorry.
No, it's all
Yes,
good.
he's a normie. He doesn't struggle with any addictions. He's blessed in that way.
Yeah. I'm glad you have the
Yeah.
support today. Do you have any observations about the fears and misconceptions that people have when they want to quit? Oh, it's going to be this bad or it's going to be like this. Do you have any observations about that?
What do you mean when
Like
you ask that question?
anticipating what might happen when you quit, like when people are still in the addiction and they're worried about how bad it could be or what might happen to them. Do you have any thoughts or advice?
My advice would be that just know that quitting is possible and it will be uncomfortable, like quitting any substance that your body has gotten used to receiving. It takes time for you to feel better, but there is help out there. And if you struggle to do it alone, then I would personally recommend you trying to seek help, like medical help, even if it's going to a treatment center. It doesn't necessarily have to be ibogaine treatment like I did, but I would just seek medical support somehow if it's too hard to do on your own.
Definitely. And on that note, if someone is listening that's not sure about quitting yet, or maybe they don't think they've gotten bad enough to quit, do you have any feedback or advice for them?
I'd say that I know how hard it is to be addicted to Kratom. I know how hard it is to come off of Kratom, and I also know how lonely and how scary it can get. And there is hope for you. You can quit. I'd say, most importantly, to thine own self be true. Just be honest with yourself about your Kratom use and how it is affecting your life. Only you can decide when you're ready to quit using, but know that if you do decide to quit, that there is help and it is possible to stay sober.
I agree. I agree. And especially, yeah, the person that is using needs to decide for themselves ultimately because that is what is going to stick is when you yourself are ready to quit. If everyone in your world is telling you to quit, you might get peer pressured into it and
Mhm.
mean the best, but like when you are ready yourself, that's when it is going to stick and that's when you're going to be ready to make that change.
For me, I had to be sick and tired of being sick and tired, you know? I just had to be over it, get to that point where it's like I can't live like this anymore. When you just never know how it's going to be for each person.
Do you have anything else that you want to share about your story that we didn't talk about?
I just want to say that this is the first time in my life since I was 15 years old that I haven't used or that I'm not using any substance, including nicotine. So I'm just super grateful to be totally clean and sober.
Congratulations. That's a huge deal. I'm proud of you.
Thank you.
It's huge. I really enjoyed talking to you today, and I appreciate the deep dive on the ibogaine treatment because I think a lot of us have heard about it, but we're not really sure what actually happens in those centers. I appreciate the deep dive there. And yeah, thanks for coming on today, Jessica.
Thank you for having me.